Good morning. The neonatal intensive care unit at Multi-Care Deaconess sees many infants from many backgrounds dealing with many different issues. But the most common issue they see is infant addiction to narcotics. It can be dangerous, even deadly, and there are no signs of it slowing down.
Those babies exposed to opioids are the bulk of babies that land in an NICU that we are treating. It's gut-wrenching seeing these babies go through withdrawal. You feel like you can't help them when you see them and they are shaking and they can't get to sleep and they try to feed and they can't latch on. It looks like there's just nothing that can soothe them.
Dr. Ager says they've seen a 14% increase in babies exposed to narcotics each year for more than a decade. And the length of stay for these babies in intensive care has been increasing too. He says this is because the drugs are becoming more potent, and more mothers are using more than one drug. This means the babies have to go through an excruciating withdrawal process after they're born. What kinds of complications will those children face as they age?
The information available is really inadequate as far as their long-term developmental outcomes. Even after they complete going through a tapering strategy here in the hospital, they still are babies that have many of those same symptoms. We have a group of nurses that are dedicated to working with these babies. They have a special interest for helping these babies, and they are a godsend.
Deb Roth is one of these nurses. She's worked in NICU for close to 3 decades because she has a calling for helping these babies through the painful process. With her team, she employs a combination of medical and emotional support.
Being a NICU nurse is kind of like putting a puzzle together. The kids talk, but in a different way, and you have to learn their language and what they're really saying to you. And sometimes you have to step back and go, okay, so what is really going on? It's definitely a team effort to get, what is best for the baby and how can we manage these kids. It doesn't take much to overstimulate their brain, and they usually shut down.
Do you find that mothers are forthcoming with the fact that they may have been using drugs while pregnant when they come to see you?
Many are. It makes it easier to identify and get those babies help right away. We need to treat narcotic addiction in these mothers as a disease and not some sort of moral decay.
It's not about that these parents don't love their kids. They do. They just have some issues that they are having trouble dealing with that's interfering with being a parent. These newborns are developing little people, and they have a full life ahead of them, and they deserve the best chance they can get. If you can get help, even during your pregnancy, will help your child.
So you may have noticed in that story that you saw a lot of machines and some empty cribs. As you know, you've done stories in hospitals before, you always have these patient privacy protections in place. HIPAA laws, but they're especially relevant for infants because you can't ask an infant whether or not he or she wants to be on TV. So they had a doll there and stuff like that, but we didn't show any infants. They have privacy rights just like anyone else. But the hospital reached out to me about the story because they say they've been seeing this increase and they want to start this conversation, both in terms of the importance of keeping these infants safe, but also not demonizing mothers who, many of them become addicted after getting a prescription, after surgery, or breaking a leg, or whatever it might be.
And we know, especially when it comes to opioids, those addictions are hard to break. So if you're already addicted and then you become pregnant, as the doctor mentioned in your story, many moms are very forthcoming and say, hey, this is the situation. My baby is going to be born, perhaps addicted. And so that can help at least get the process started for helping the babies, right?
Exactly. And that's another reason they want to do the story, is raising that awareness, but also if they can start breaking down this taboo and make mothers feel safe to come forward and say, yes, I am addicted to this, they really can make huge strides for your baby even before he or she is born, just having that information and having those safeguards in place.
Interesting topic this morning. Thanks so much, Rob.